Hi there, and welcome to 4 elements for objective evaluation of the people in your dental practice. This is a topic, an area that is sometimes really difficult to look into, partly because we're probably a bit scared of what we might find and what we might uncover and what we might have to do as a result. However, sometimes those things we have to do can be really positive. And if we don't do this exercise of evaluating the talent in our dental practice, we can soon end up in a bit of a pickle, a bit of a situation. This is particularly true for dental practices because it's a service-led business. Your dental practice is a service-led business, which means that the people are providing that service. And so if you haven't got a real clear idea of your talent, of your people, then you could end up without being able to properly provide the service that you really want to provide. So I'm going to look at 4 different elements that will help you objectively look at the talent in your dental practice. And I say that because we're often biased according to our own personality styles. We often like the people who we are alike. And also perhaps due to recent situations that have occurred, we can sometimes be really biased in how we evaluate different people. So this is, I hope, going to give you a structure by which you can actually evaluate the talent and the people in your dental practice. It's pretty straightforward on the overall surface of it, but hopefully gets you clear and a bit more objective in how you look at your talent. All right, so number one is this, which is, can they do the job? So there's a step before this around understanding what jobs you need to be done and lots of other planning like that. But we're not going to look at that. We're just going to purely evaluate the current people in their current roles. So that's the first question, is can that person do the job? Simple, right? Well, maybe not quite so simple. I would recommend splitting it into 2 different parts. The first part is the technical part. So technically, can that person do the job? As an example, you want an associate to be doing general dentistry. Can that person perform the necessary general dentistry that's required, both from a regulatory and legal perspective, but also the quality of the work they do? And you can look at this from the point of view of listing kind of all the things they need to do in that role, and can they do them? If they can do all 10, then awesome. They get a whole 100% for that score of being able to do the job. If they can only do 5 of the 10, then they only get 50%. And this gives you a clear indication of whether they can do the job or not. Now, to go with that, there's a second element to that, which is actually around the level and quality of that work. So how well do they do those specific tasks? And again here, this is about the technical things. So how well can they do a specific procedure? How well can they do a specific element of the job that has to be done? All right. So that's about the technical capability of that person. Gives you kind of 2 overall scores of what they can do within the job, and then how well they can do those specific elements of the job, giving you a clear indication of on that particular person and can they do the job. The second part of can they do the job is what I would say is more competency based or behavior based. So what behaviors are really critical for that job? An example of this would be a dental nurse. Perhaps I would imagine a really important competence for dental nurses is to be able to build great rapport with patients and have a real level of empathy and understanding with patients. Now, that's up to you to choose what you think are those ideal competencies, maybe those top 5 behaviours that are most important for that role. But once you've done that, then you can rate that person for that job on their ability to demonstrate those behaviours. On a scale of 1 to 10, you then rate their ability to demonstrate those behaviours. On this one, it's more a question of, are they at a place where it's acceptable? So it's not as black and white as can they do the job or can they not do the job. It's, are they at a place that is acceptable where they can build rapport, for example, to a good enough level? If not, how long will it take to get them to that place? And that's the same with the technical competencies. If they're not able to do those technical competencies, how long will it take them to be able to be in a place where they can do it? All right, so that's the first broad element, is can they do the job, split into technical and behavioural based. Element number 2, or question number two rather, is do they want to do the job? So do they want to do the job? We have to get a feel for how much they want it. If people want to do a job, they will go to significant efforts to make that happen. And so often wanting to do a job is often considered more important, especially compared to the technical behaviours, to the technical competencies, because they can often be taught. But if we have a drive and motivation within us to make that happen, then that's going to go a long way for that person being successful in the role. So do they want to do the job? Now with this, we can split it into 2 areas to think about, which is more getting a feel for the balance of their want and drive. So which is the intrinsic, so are they more intrinsically motivated or are they more extrinsically motivated? So give them a rating on a scale of 1 to 10 about how motivated they are. And then what's the balance between being intrinsically motivated, which means it comes from within, rather than being extrinsically motivated, which means they're driven by external factors such as either money, or so that's reward based, or maybe fear based because they're fearful of if they don't have something, that's what drives them. So this is external, whereas intrinsically is we do things for the sake of doing because we enjoy them, sometimes for the challenge, sometimes for the learning, and sometimes just for the experience because we enjoy doing it. Now, we're all a balance of both intrinsic and extrinsically motivated and intrinsically motivated. But for people where there's a greater level of intrinsic motivation, it's more sustainable. Extrinsic motivation, there always needs to be more of that provided. It's pretty short term, so things like money, rewards, they might work in the short term, but you have to keep providing more and more of them. And actually, it's more complicated than that in terms of the impact that has on the job that they're doing. But that's for another video. For the time being, we really want there to have a better scenario if the individual has a level of intrinsic motivation within them. The higher that is, the more sustainable it is over a longer period. Okay, so I hope that makes sense. So the second part is, can they do the job? And it's a question of being either intrinsically or extrinsically motivated, amongst their actually understanding what you feel their overall drive and motivation is, how high that is on a scale of 1 to 10. So you're starting to build up a picture for each individual about, the talent and the people you have within those different roles. Now, the third element for me, which I think is really, really important and sometimes overlooked, is the impact on the overall team. So what is that impact that that individual is having on the overall team? Because as good as they might be technically, behavior wise, and even from a motivation perspective, how motivated they might be, if they're negatively impacting the overall team, then overall that's much worse. The impact is much worse than them just doing their job, than someone who was doing an okay job but really positively impacting the whole team. So we really have to look at that third element is, what's the impact on the broader team? And there's 3 different areas for this. First one is called psychological safety, which I've spoken about at length in other blog video articles that I've done. And that is the person behaving in a way that's open, that's honest, that is challenging, so is able to challenge behaviors, also to engage in conflict effectively without moving into mean personal attacks, happy to listen to others, to debate, to be open, to ask for help. Do they demonstrate all these types of behaviors? Because that will help create an environment of psychological safety within your team. So psychological safety. Second one is, are they living the values? Again, I've talked at length about values and the importance of values. It's important to define the values of your practice. And then living your values means, are your team really living those values? Is this individual really living those values? If so, then great. They're showing the way, they're leading the way by example. But if not, this is really putting a spanner in the works for you as a practice demonstrating these values. So do they live the values? And actually the ultimate is, are they holding others to account within the dental practice to those values? So that would be the ultimate for a person, is they're actually living those values and then holding other team members to account about those values. So values, that's the second one in terms of the impact that they're having on their team after psychological safety. And then the third one is what I call about the vision. Are they getting in the way of the vision, or are they actually helping to take the practice to the vision? So is the person putting up barriers because they don't like change, they're not wanting to get involved, and they're actually blocking it almost? And this is really detrimental to the broader team, because it's stopping the practice and moving in the direction that you want it to move. So this is all around change, that vision one. Are they embracing the change that's taking you as a practice to that new place? And if not, and they're really putting barriers away, this is a real problem. So 3 different areas of impact they are having on the broadened team, which is psychological safety. Are they behaving in a way that creates this psychologically safe environment for everybody? Number 2, are they living the values? And number three, are they really helping and supporting others and facilitating others in making that change happen towards your vision of the future? All right, so that's 3. The fourth one then is about potential. What is the potential of that individual? Now, this is a tricky one to measure. In the corporate world, how it's done typically, I think can be translated a little bit into the dental world, which is, you can think about, can that person move up a level hierarchically within the organization, or maybe 2 levels or 3 levels? You can say whatever it might be. So as an example, does that nurse have the potential to move up to being a lead nurse? And then maybe actually that nurse has the potential to move up to being a practice manager. That could be a natural next step, in which case there's a kind of 2 levels of potential for that individual. So this is a way of putting potential for people, so you can start to see how that might flow within your organization and potentially plan as to how that might move forward in the future. Now, it depends on the size of your practice and your team, but this is definitely something to consider, particularly if you have a bigger team. But either way, you can start thinking about, well, what's the potential of that person? And it gives you an idea, because then you can start thinking about, well, what could we do for that person to help drive that potential in the future? And it's good to have a mix of everything. People are happy in the place that they are, very competent at that place, no real potential to move up. At the same, because that creates a level of stability and people to learn from and help in those roles. But also it's good to have some movement upwards and growth and development. Those are the 4 different elements by which you can evaluate the people, the talent in your dental practice. Number 1, just to repeat them, is can they do the job? And that was split into technical and behavioural. Number 2, do they want to do the job? Do they want to do the job? And that is intrinsic versus extrinsic levels of motivation, but overall how motivated and what's their want to really do the job. And number 3 is what's the impact on the broader team of that individual. And that's based around psychological safety, it's based around living the values, and it's based about facilitating and helping the practice go towards its vision of the future rather than blocking it. And lastly, 4thly, it's around potential. What's the level of potential that that person has within the organisation to move up a level or 2 or 3? Those are the 4 different elements. If you signed up to my blog, there's a little pop-up will appear to help you download a template that you can use to populate and do that for your dental practice. If not, sign up for the blog and then you'll see it and it will pop up, and so you can download it then. So you can download the tool, the template then, that you can populate to evaluate the talent and people in your dental practice. Thanks for watching. Bye for now.